I just went to the funeral of my cousin's wife. She was somebody who refused to get the vaccine. And it was such a senseless loss because how many people would love to have the opportunity to take that vaccine?
A challenging loss in Dr. Schroeder's family that he hopes others can learn from when considering getting their vaccinations.
If you've been around town, it feels like life is getting somewhat back to normal. Masks are coming off. Businesses are moving away from social distancing.
And less than 50% of our population has been vaccinated. And thankfully, that has lowered the number of new cases and folks in our hospitals. But doctors warn it's not over yet. KLBK's Olivia Whitehead joining us now. What are some of the concerns moving forward?
Now, just like other viruses, there are already new strains of COVID-19, with the most recent being the Delta variant, and it's already made its way right here to the hub city. Now, what this means is we could see another wave of infections in all the folks that haven't gotten their shot.
The most recent report that I heard within the last couple of days says that very well could be the most prevalent variant coming this fall. And if we see a tapering off of the vaccinations like we run a greater risk of seeing more of these variants take hold.
A cause of concern for those not vaccinated.
Think about it as an equation. All the people who are protected equals those who've been vaccinated and those who have had COVID. And that's the number that we don't know much about.
While some may be asymptomatic, those that aren't remain at risk.
Anybody that we're seeing right now, unfortunately, has made the decision to not get vaccinated. So that's why we're asking everybody, please get vaccinated, because this can avoid a hospitalization for you.
The good news is these vaccines seem to fight off all COVID-19 mutations.
Really, the reason that you need a booster is if the virus mutates enough that the vaccine is no longer effective. And it appears that the vaccines are protective for those variants. So right now, it doesn't appear we need to do a broad booster campaign.
Which comes in handy right now as travel ramps up.
If you're in either one of those groups, you're probably feel like you're protected. It's those who've not had the vaccine and not had the infection that are at risk. And if they travel, the exposure is going to bump up.
Both doctors tell me they understand the fears and uncertainty many still have around getting vaccinated, but stress that there are greater risks to actually getting the virus.